Management Summary for Anxiety, Depression, and PTSD by Harris Escobar and Lesya Yegorova. Anxiety is a state of apprehension that might involve an internal physiological conflict, environmental stress, physiological disease state, medicine or drug effect, or combination of those. Depression is a mood disorder that is characterized by extreme exaggeration and disturbances of mood. PTSD is a syndrome of psychophysiological signs and symptoms that develop after exposure to traumatic event outside of usual range of human experience. Anxiety is usually self-diagnosable. People may experience trembling, twitching, or feeling shaky, restless, fatigue and shortness of breath, palpitation or tachycardia with sweaty or cold, sweaty hands, dry mouth or trouble swallowing, dizziness or lightheadedness, nausea, diarrhea, and frequent urination, feeling on edge, difficulty concentrating, or trouble in falling or staying asleep. Time to time most of us feel sad, lonely, and depressed, and it's a normal reaction to events such as loss or life struggles. But when these feelings become overwhelming, causing physical symptoms and last for a long period of time, they can have negative impact on normal life. People may experience signs and symptoms that occur on a daily basis, such as depressed mood, loss of interest or pleasure in daily activities, significant weight gain or loss when not dieting, insomnia, hypersomnia, psychomotor agitation or retardation that is observed by others, fatigue or loss of energy, feeling of worthless, and excessive guilt feeling. Not all, but some people might develop post-traumatic stress disorder that characterized by irritability, constant feeling of potential threat around them, and insomnia. Secondary drug and alcohol abuse is common as well. Possible treatments that might reduce signs and symptoms of anxiety, depression, and PTSD might include psychodynamic and cognitive therapy, hypnosis, and desensitization. Treatment usually followed by medications such as benzodiazepines, antidepressants, and antihistamine. Adverse reaction may occur for those who take in benzodiazepine. Care must be taken when this drug is prescribed for sedation to control dental-related anxiety in patients taking barbiturates, opioids, or psychotropic agents. They may cause overdepression of the central nervous system, leading to respiratory distress. Diazepam can result in drowsiness, therefore contraindicated in those who drive or operate machinery.
Oral signs and symptoms. Mental conditions such as anxiety, depression, and PTSD affect the whole body, including oral health, therefore can cause oral disease. Some medications can cause xerostomia, which can lead to tooth decay due to the restricted salivary flow, which can also lead to periodontal disease. Some of the medications and the conditions themselves can cause TMD due to clenching and grinding, which can damage tooth structure and cause other issues with mastication. The management and special cautions of patients in a dental office. Always observe a patient's physical appearance, speech, and dress. Always establish effective communication. Always explain procedure with short question and answer, breaks to address the patient's concerns, and pain-free procedures with local anesthetic and inhalation sedation with nitrous oxide if not contraindicated. Inform patients about possible discomfort and assure them that things are going well. Give post-operative instructions thoroughly. Analgesics are extremely important to control post-operative pain. Consult with DDS. Social, psychological, and cultural barriers affecting dental care recommendations. Childhood experiences are factors in the development of ill feelings towards the dental clinicians, which can exacerbate their condition and cause ill feelings of envy and awe, leading to less compliance and treatment recommendations. Patients with PTSD may view dental clinicians as authority figures and blame them for some of their traumas and traumatic experiences, leading to distrust, loss of control, or both. If trust is not gained, patients may fail to follow recommendations. Patients with anxiety may avoid dental visits due to added anxiety associated with past negative dental experiences, hindering following and implementing any oral hygiene care educations given. Consultations, referrals prior to dental treatment. Medical consultation will be used to establish the patient's current status, to ascertain the medications the patient is taking, to identify any complications or contraindications. Also to confirm dental medications and doses to minimize the possibility of drug interactions. Also to confirm what medications to avoid with these patients or what medications to reduce dosages of. Management of patients with anxiety, depression, and PTSD in the dental office. We always want to develop a solid relationship and gain trust. We always want to review and do a comprehensive medical and dental history. We also want to observe any signs and symptoms of the conditions. We also want to have open communications, and we always want to ensure a medical consultation for patients with advanced anxiety, depression, and PTSD